So, good morning, everyone. We're here to present Jean Watson's philosophy and science of caring. So, our discussion would include her personal background, her theory of human caring, of course, and its three major elements, namely declarative factors, transpersonal caring relationship, and caring occasion, the theory assumptions, Watson's hierarchy of needs, the four major concepts, and her nursing process.
So, good morning, everyone. Dr. Jean Watson is a recognized professor, nurse theorist, and organizer and chief of Charitable Watson Caring Science Institute. In 2013, she was granted the American Academy of Nursing's Living Legend Award. She is most popular for her theory of human caring and 10 Caritas processes, which will be discussed later. Um, Watsons was born in Welch, West Virginia, and got her Bachelor of Science in Nursing from the University of Colorado in 1964. She proceeded to finish her PhD in Educational Psychology and Counseling from a similar college. She has since earned 10 privileged doctoral degrees and has broad experience working in emotional wellness nursing and caring science. Her continued research is engaged in the territory of human caring and loss. She made the theory of human caring somewhere in the range of 1975 and 1979. Her expectation at that time was that her hypothesis would help her recognize nursing science as a different and significant element from clinical science. Her work was impacted by her showing experience and was made as an approach to discover normal importance among medical attendants from everywhere throughout the world. Her hypothesis was first distributed in 1988. Since that time, she has delivered in excess of 20 books on caring, and her lessons are utilized by clinical medical attendants and scholastic projects everywhere throughout the world. So for theory of human caring, caring is the essence of nursing and connotes the responsiveness between the nurse and the individual. Blueprint for nurses in restoring the art of nursing practice through better care for their patients and themselves. Emphasize humanistic aspects of nursing as they intertwine with scientific knowledge and nursing practice. Composed of three major elements: 10 corrective factors, transpersonal caring relationship, caring occasions. So this theory is basically the middle range nursing theory, or the theory is more focused, concrete, and geared towards practices.
Watson's theory assumption states that caring can only be effectively demonstrated and practiced interpersonally. It is the ability of the nurse to express how he or she cares for the patient and develop relationship. Caring consists of curative factors that result in the satisfaction of certain human needs, and these factors are assumed to be better in providing healthcare than conventional medicine's curative factors. Next is effective caring promotes health and individual growth or family growth, and caring responses accept a person not only as he or she is now, but as what he or she may become. A caring environment offers the development of potential while allowing the person to choose the best action for himself or himself at a given time. And caring is more healthogenic than is curing. The practice of caring integrates biophysical knowledge with knowledge of human behavior to generate or promote health and to provide ministrations to those who are ill. A science of caring is therefore complementary to the science of curing. And lastly, the practice of caring is central to nursing.
So the 10 curative factors is one of the major elements of Watson's theory. So During her time, she used the factors as the guide for the core of nursing, since this guides the aspects of nursing that potentiates therapeutic healing process and relationship. So eventually, the curative factors became the clinical caritas process, wherein caritas is a Latin word that means to cherish and appreciate or to give a special or loving attention to. So the factors were made in contrast to the curative factors of nursing. So here are the 10 curative factors. And today we're going to discuss the first four curative factors, since these are the philosophical foundation of the science of caring, and the remaining factors were only derived from the foundation. So the first curative factor is the human altruistic value, wherein the Caritas process is the practice of loving kindness and equanimity within context of caring consciousness. So this factor talks about the values shared with our parents, and the factors or the values that were mediated through our own life experiences and the learnings that we gained through our exposure to humanities. So the next factor is the installation of faith and hope, and the process is called being authentically present, enabling sustaining the deep belief system and subjective life world of self and the one being cared for. So it is vital to both curative and curative processes, and provides a sense of well-being through the beliefs meaningful to the individual, and promotes a holistic nursing care and positive health within the patient population. So next is the cultivation and sensitivity, wherein the process is called the cultivation of spiritual practices, and transpersonal self goes beyond the ego self. So this means that the nurse needs to strive to become more sensitive, since it makes nursing more authentic and encourages self growth and self actualization for both the nurse and individual. It promotes health and a higher level functioning when we are able to form a person to person relationship. Lastly, the development of a helping trust relationship, wherein the process is called develops and sustains a helping, trusting, authentic, and caring relationship, which is crucial for transpersonal caring, since um, this establishes rapport and caring within the nurse and the individual, and has the characteristics congruence, empathy, non-possessive warmth, and effective communication. So for the next,
The fulfillment of human needs describes the nurse's role in promoting wellness and health through the achievement of Watson's hierarchy of needs that is inspired by Maslow's. It is broken down into two classifications, and these are the lower order needs and the higher order needs. The hierarchy begins with the lower order biophysical needs or survival needs, which pertains to the basic necessities of the patient, such as food and fluid, elimination, and ventilation. Next in line are the lower order psychophysical needs or functional needs that includes the need for activity, inactivity, and sexuality. This pertains to sexuality and integrative needs to communicate. Patients must satisfy lower order needs first before attempting to attain higher order needs. The higher order psychosocial needs or integrative needs include the need for achievement and affiliation, and higher order interpersonal need or growth seeking need is the need for self actualization or recognizing one's fullest potential. Each need is equally important for quality nursing care and the promotion of the patient's health. In addition, all needs deserve to be valued and attended by the nurse and patient.
so for the next element of her theory is the transpersonal caring relationship, which also serves as the foundation to her theory. So transpersonal means going beyond one's ego, and allows one to reach deeper spiritual connections while still comforting the patient. So it focuses on helping the patients achieve a more complete sense of harmony within the mind, body, and spirit through the use of caring transactions. So these are the characteristics that depends on the development of that relationship. So it depends on the moral commitment of the nurse in protecting and enhancing the human dignity as well as the deeper or higher self. It depends on the caring consciousness communicated to preserve and honor the embodied spirit, not reducing the moral status of an object. So this means that the patient should not feel objectified in any way. And lastly, the nurse's caring consciousness and connection having the potential to heal since experience, perception, and intentional connection are taking place. So this means that the nurse should go beyond their objective assessment and show concern towards the person in a subjective and deeper manner concerning their healthcare situation, since the goal of this relationship is to protect, enhance, preserve a person or individual's dignity, humanity, wholeness, and inner harmony. So for the caring occasion, it is the moment or time wherein the nurse and the patient would feel connected or together in a way that the human caring is created. So in this moment, the nurses becomes a part of the patient's life history and dictates the ability of the nurse to have an overall impact on the patient, which provides a more meaningful work for the nurses. So this moment transcends time, space, and physicality, which is created through the use of curative processes. So here are the four major concepts or meta paradigm as described by Jean Watson. So first is the individual, which she used the term human being, and this means that she described this as the unity of mind, body, and spirit, and the value of the person to be cared of, respected, nurtured, and understood and assisted. Next is that the society. So Watson did not really explicitly describe the term environment but use society instead. So she described this as it needs to be conductive to healing and that the individuals and their environment should be connected. It also refers to the frame of reference of the individual and should be considered, and the nurse should strive and try to stay within that reference. She also says that caring is not transmitted through genes but through the culture of the profession as a unique way of coping with its environment.
So for the nursing health, so for the nursing science of person and health illnesses experience that are mediated by professional, personal, scientific, and ethical are interaction. So the nurses focuses their care for the patients in promoting health and prevent their illnesses. So for the health, it is lastly, it is high level of overall physical, mental, and social functioning. Next. There are four nursing process: the assessment, care plan, intervention, and evaluation. Assessment first, assessment plan includes observation of the situation, identification and analysis of potential genetical risk factors in a patient, and review of the problem as well as the formation of a hypothesis. Second, the care plan. It helps the nurses to determine how variables would be collected. Third, intervention. It is implementation of the care plan and data collection that was processed in the care plan. And lastly, the evaluation analyzes the data, interprets the result, and may lead to an additional hypothesis. That's all. Thank you.
Okay.